Welcome to Joint Effort PAs, where two orthopedic surgery PAs get real about life in medicine. From tips and tricks to professional growth, work-life balance, and everything in between. We're here to share what we've learned and what we're still figuring out. Let's get into it. We're back.
We're back. Post holiday.
Post Thanksgiving. How was your Thanksgiving, Beth?
It was great. It was adventurous. Did a lot of things.
Yeah.
A lot of family, a lot of things, a lot of physical activity. I think I had talked about last time, like when I take multiple days off. So like today is day number 5. My body goes into shutdown. Like yesterday, I was awake and I was napping. I was awake and I was napping. It's like my body's way of resetting. I just want to nap all day.
I slept until 7, so that was it was a huge thing.
Yeah, I mean, like I'm getting up at the same time, but like I'm up for 2 hours and I like have to go take a nap, which is that's not normal behavior.
Well, your body is like, you're preparing. It's like kind of a hibernation mode kind of thing.
It is. Yeah. There's some reset that's occurring right now.
Yeah.
But stress wise, I feel great. What about you?
I feel fantastic. It was a good Thanksgiving weekend. I finished my run. I was very proud about that. I hit my time goal. So
that's huge.
Oh,
Congrats.
So one of the surgeons here, he ran it too.
Oh, really?
Yeah. I think one of our joint surgeons,
okay,
and you can guess which one it was.
Yeah.
Anyway, I kept seeing him pass by the opposite way.
Oh, like he
because he's that good, that fast, right? So I'm running down this way and he's running down the other way, and in my mind I'm like, oh, I get to turn around soon.
Yeah.
And that didn't happen because he was just that much faster. So I kept seeing him going the opposite way, hoping that meant the end was near, and it just wasn't.
No, he looks like a runner though. So
yeah, because he is. And if I tell you how fast he finished it, it was like an hour and 20 minutes or something. That's 20 something. It was crazy.
That's impressive.
Yeah, I know. I looked at the results after because.
Do you think he trained for it? Probably not even.
No. Some people are just overachievers, and I want to be one of them. So, what is my next thing in life? I don't know. What do I do next?
You should do a sprint try when it's not cold out and you can swim. Those are fun.
But in a lake?
Yeah.
Swim?
Yeah. Oh, deal breaker. Okay.
Well, no, I just have never swam in a lake.
Yeah.
Could train out there.
There you go. Oh my gosh. Watch out for the floating alligator head.
Yeah, we don't have to worry about that anymore. Okay, so our topic today is going to be awkward encounters.
Yes, awkward patient encounters, which kind of was sparked in conversation, at least throughout my holiday. We were talking with family, and again, family has an idea of what I do. I don't think they really know what I do, the everyday stuff. So when I tell them about, certain things that I do or patient interactions, they're like, what? And I'm like, oh, this is just real. A tip of the iceberg. I can keep going.
You do have some really good ones. I don't know if my brain blacks out those memories of I have some awkward ones, but yours are really solid.
Yeah. So we're going to share these, and I hope that this normalizes the things that I go through, but even just our pre-prep, I'm not sure it's going to, because I think these are random events that just occur in my life.
Yeah, but they have to be talked about, because you can't hold on to these things on your own forever.
Yes.
Okay. What are we going to start with?
Yeah. So one of the benefits, and again, why I like ortho, and even more so for you, you work in hand, so your visits can be quick because there is no undressing.
Yeah, that is part of the reason I chose hand surgery.
Yeah. There's no oh, I'm going to step out. Here's this very thin paper gown or now paper shorts that you can put on. Mm-hmm. You don't even need to do that. You're just hey, can you roll up your sleeve, right?
Yeah.
Even your shoulder patients,
Yeah, sometimes, very rarely do I have to get somebody to scoot their arm out and under, but they're out and it's exposed.
Yeah, so in a patient encounter, and again, let's talk about the dressing, right? Yeah. It's rare, but when it needs to be more or less, it's just so awkward. So the job of the medical assistant, bring the patient back. If you're being seen for a knee, theoretically, they need to take their leggings off or roll them up, right?
If you can. I can't roll my leggings past my knee or I'll tourniquet myself.
Okay, but that's what happens half the time where I'm like, oh, your knee. And then I see that they've got like leggings and whatever on. So I'm like, all right, can you roll the legging up? Knowing the answer is no.
You watch them try,
and
though.
I watch them try, and then they tourniquet themselves. And then I can't really get a good exam. And then I'll say, hey, do you want a pair of shorts? They're like, no,
this is fine.
I don't need that. I'm like, oh, God, okay.
It looks bad.
Yeah. Or the patient that you walk in and they've got jeans on and they absolutely cannot roll up their pant leg, or they can, they just don't. And you're like, all right, I'll step out if you want to change. And then they'll say to me like, hey, I'm comfortable if you are, and then just drop trow.
Yeah.
So that's happened a bunch where that happens. And then 90% of the time they are wearing underwear, and some of the time they're not.
Yeah.
And you don't know until you know.
Right.
But you'll try to walk out of the room and then they tell you to stay, but then you comply by staying. So I still try to walk out.
And you have to just like be there.
You just have to be there. Like the room has 4 walls. So you just stare at one of them, I guess.
Yeah. I mean, like again, medical profession. So it's fine. Like, I'm not saying anything was wrong with this, but like even at the gynecologist, like, they step out while you're undressing, right?
The etiquette is step out, undress. They'll give, I don't even know what the right period of time is until they stop hearing rustling in the room.
Right.
Like the patient, the unknown or the unwritten like rule is they crack the door, therefore they are ready.
Yeah.
I don't know.
I don't do that. Well,
I don't
you
do
can
that
at the gynecologist because like, you just,
no. But yeah, so I've had that weird things happen, or even with the shoulder. I'm like, hey, can you roll your shirt up or sleeve up? And sometimes they can, and sometimes they can't. And then they're rolling it up and then it rips. And I'm like,
didn't mean for that to happen. Or like the no bra thing.
The no bra thing. That happens
which is
post-op all the time.
Yeah. I'm accustomed to that.
Yeah.
I wouldn't either.
Yeah. That's fine. But the whole, orthopedics, there's not a lot of dressing and undressing. Like, you're not at your primary care. You're not at the dermatologist. You're not there. But there is like some confusion when we get to that part of the exam.
Yeah. Speaking of confusion, I had a patient last week who, I don't know if this was on me or on them, but so you know how our rooms are set up. We've got like the exam table, and then we have a little bench with like a counter next to the bench.
Yeah.
The counter has like flyers and pamphlets and anatomy models and stuff on it. So I'm sitting in the little rolly stool next to the bench. He's on the exam table, and since I'm looking at hand, it's actually easier to have them on the bench, like next to me. So I like put my hand, I guess, on the counter, like motioning towards the bench, like, why don't you sit over here so it'll be easier? And he came and sat on the counter. And I was like, oh, actually, like I was trying to make it not awkward, like not make him feel like he did something weird.
Sat on the tissue box.
Like he sat next to the models, like on the pamphlets, like on the actual counter. And I was like, actually, you can sit down here. But that was probably my fault. That was on me.
But that's like a pat. Like if you pat the counter. I think it's implied that.
Go to the counter.
Did you still do the exam with them perched on the counter?
No. He like slid himself down.
So awkward.
I made it worse. That was on me. Sorry.
Yeah, the positioning of the patient too. In the room, like we have rolling stools. I can roll to your left. I can roll to your right. I can stand, whatever. And then if they're sitting in the rolling stool, like that's not yours.
Yeah.
I mean, there's nothing that says you can't, but like when I come the choice of the bench or the table's your place.
Yeah. And have you ever come in the countertop? And sometimes I have to sit on the counter because if you ever come in and there's so many people in the room that somebody has claimed the stool and the benches like the exam table's the only empty one. Sometimes I sit on the exam table and talk to them because like they've taken all the other spots.
Yeah, no, I've done that too.
And it's like weird role reversal.
Yeah. Yeah, I don't know. I mean, you'd think there's not a lot left to happen when the medical assistant is there. The provider will be right in. And then you get into all the weirdness. Just setting the stage for how the visit's going to go, just going where you want to go in the room, have the patient expose whatever body part you need them to. There's so many awkward things that happen.
So many awkward things.
And then they always sit on the table when they sit on the table and then the paper rips and then they get so embarrassed.
Yeah.
And then it turns into, I'm
sorry, I ripped
sorry,
it.
I'm overweight. And I'm like, no, it's
Wait,
like literally meant to rip. Like if you get on the counter at that speed, it's going to rip like that. So that, oh God, anyway, so that's all before the visit starts.
Yes.
That's fun.
Yeah. That is the stage setter.
Have you, so let's get to where the patient like rolls up their shirt or takes their shirt off or whatever. Let's say you open the door and you get hit with like the BO.
Yeah, I don't know. I think honestly, I'm immune to that. I was thinking about, I think as an athletic trainer, I like that is not a thing. And like the cast odor.
Yes.
Just mostly immune. Not completely immune.
No,
like I recognize it, but I don't think.
But what happens with your face, like when you open the door and because it's a closed room, so whatever's happening in the room, when you open the door, you're hit with it. So like you walk in the room, you're hit with the smell, and what does your face do?
I think it stays the same. I don't know. Maybe it doesn't. Like it probably doesn't. Though, if we had a video, if this was like Oskies.
Yeah.
Or were videoing me, I'd probably be surprised.
Do some things. Yeah. I think like, I don't know. I feel like a little twitch happens when I'm like, all right, this is going to turn into like a mouth breathing situation. Or like even like a strong perfume. Sometimes that bothers me more than like body odor where I'm like, oh God, this is like I'm chewing it.
Well, we don't deal with feet. So
no, we don't deal with feet.
We're okay in that regard.
Yeah. But you can also smell. And this has happened when I worked urgent care where you open the door and you're like, something's infected in here. Yeah. Have you had that? Yep.
Yeah.
That's not funny. I can't even put my finger on it, but it's like in my memory of what that smell is.
Yeah. And there's different ones for different instances.
There are different ones.
For different infections.
Yeah.
Yeah.
So that's fun. All right.
Oversharing. Yes. I mean, this is where the bulk of the awkward scenarios occur.
Yeah. So we see patients for new visits, like new problems, and then we'll see them for follow-up visits. So there's rapport, like these people, right? So there's the small talk, which we've talked about before. And then there's like stuff to fill the void. Like if you're, let's say, doing an injection for someone and you're kind of getting set up with the ultrasound, like there's either dead silence or you're small talking.
Yeah, I do a ton of small talk.
So have you gotten in any situations where a patient just goes like off the chain?
Oh, totally.
Sharing things?
Yeah.
Like unrelated to anything you've asked or implied to ask?
Yeah.
Not related to why they're there?
Yeah. I mean, we have the uninvited ones, right? Where like when I just ask a simple question like, can you bend your finger? And they're like, well, my grandma, 10 years ago couldn't bend her finger. And then her dad died. Like it's just a whole saga.
That I've had that happen. But I've had let's share a couple stories. So I had one patient and I remember him. He was a football player for one of the high schools and he came in. This was actually an urgent care. He came in and injured his knee, injured his thumb. So looked at his thumb first because he actually had a fracture on x-ray, but he also tore his ligament. So he was more concerned about his thumb. And it was one of those things like, hey, I hurt my thumb. Also, can you look at my knee? So I told him that he broke his thumb and he tore his ligament and he would require surgery. He started crying, right? And this is like an 18-year-old senior year of football during the season.
Happens,
he's there with his mom. His mom's like rubbing his head. And then he's like, hey, can you look at my knee? And then I examined his knee. I was like, and I think you tore your ACL. And then it just went like full waterworks, right?
Yeah.
So saw him in urgent care, saw him in clinic, operated on his knee. And this was 3 months later, 12 weeks after ACL surgery. The brace is gone. We're talking about like, getting ready to run. So a very functional patient. And the mom was like, I said, do you have any other questions? The mom was like, yeah, when can I stop showering with him? I was like
10 weeks ago.
Week 1, probably. So I think it's safe now to let him shower by himself.
Interesting.
Yeah. I was like, oh my God.
Wait.
And she looked at me because I must have had some reaction. She was looking at me.
How do you not?
She goes, well, I mean, I had a bathing suit on and I'm like.
So she like felt the need to defend
but like,
what you were thinking because your face said that.
I know you did, but like, did everyone? I don't know. I was kind of like, in that case, no, continue, please.
Yeah. If you're both wearing bathing suits, it was totally normal.
Yeah. Okay. So that's always
family
fun.
Showers.
Yeah.
Right?
That's always fun. But yeah, God. Do you ever have patients ask you like your opinion with like CBD or something like that, and then it turns into more than
of like
that?
yeah, like are you
Yeah.
what are you
More
what are
like
you into?
They
Yeah.
asked like it's medicinal questions, and then it kind of turns into more than that.
Yeah, what kind of they're trying to get a vibe feel.
Yeah.
Like,
or like a pre-op visit. I'm like, oh, do you smoke tobacco? They're like, not tobacco.
yeah, something
I'm
else.
like,
Dude, I'm cool. Like, whatever you want to do.
I know, but it opens the door for like they want you to ask them more, I think.
Yeah.
Right?
Yeah. I don't know. I think they want you to like reinforce that it's okay.
Yeah.
I don't think they want like validation.
Yeah. I mean, I guess the age demographic, I don't know. or they'll say like, hypothetically, if I were to use other products than tobacco, would that be okay? And I'm like, hypothetically, it depends, I guess, right? Like,
Well, I'm gonna try to normalize your
Please.
awkward encounters. So I don't know why, but I think I give off this. Do you ever feel like you give off an air that like you're available to
yes,
say things that shouldn't be said out loud?
Yeah.
We had a particularly difficult patient who like I just wasn't vibing with. He like personality wise, I think he kind of felt that he knew probably more than me. I don't know because I'm a 5'3" woman, tell. But I could tell. Yeah,
you can tell. Yeah.
I tried to level with him on things that we did have in common. You know, when you like don't vibe with somebody and you're like, let me find our connection points so that we can vibe. So I really like honed into those things. And as we got farther into those things, which just happened to be exercise and working out and like fitness and stuff, we like got deep into gym conversations. And then we started talking about peptides, which is a personal interest of mine. And he's like, oh yeah, I used to do peptides. Like I was jacked when I did them. And is like, let me show you pictures of before. And I'm like, oh my God. Pictures.
Love pictures.
It's shirtless pictures
of course
of like his six pack. And that's happened to me not once, but twice.
Yeah.
Yeah.
But you led yourself there. Like
I did. And I'm like, I blame myself for these.
In some respect, you asked to see those pictures.
I did. I was like, do you have any pictures of when you were jacked?
Yeah.
I'd love to see that.
I'd love to see them.
Yeah.
It's so ridiculous. It's so ridiculous. You're just like, can I get out of this room fast, please?
And then when I exit and I tell everybody what happened, they're like, there's no fucking way that happened. I'm like, it did happen. That just happened to me. Why did nobody like knock on the door while that was happening?
Yeah. Have you ever had, and again, being a mid-level early in your career versus being mid-level middle in your career, someone who just like does not think that the diagnosis you gave him is real, or like
all the time
really wanted surgery and you're like, but this doesn't need it, and they continue to like argue with you?
Mostly when there's like nothing I can put my finger, like nothing that I can find that's wrong with them.
Yeah.
Like they don't believe that, which I get is like sometimes hard to believe.
Yeah.
But i.e. my frostbite patient who's like, I stuck my finger in ice water for too long and like it started really hurting and it got really cold. And so I went to the ER and they told me that I might have frostbite and to follow up with you guys. And I think the ER just was like,
push.
Next, yeah.
Or I mean, patients who like nobody likes hearing the diagnosis arthritis. And when you say that, they just don't like that that's the case, right?
Arthritis or tendinitis. I don't know why tendinitis is like, I say that to people and they're like, okay, there's no way it's that because like I actually hurt and clearly you don't believe me.
Yes.
And like what I'm having is painful.
Yeah.
So it's not tendinitis. You dumb.
Or I know. Or like knee arthritis. Like not all arthritis is the same. Early arthritis versus very advanced arthritis can present similarly or very, very different. When you tell someone they have arthritis, like, that's it? And I'm like,
but that's a thing. Yeah.
Like that's okay to have that.
That is a reason, yes.
Yeah. Or they're like, so I need surgery? I'm like, well, no, you don't need surgery. And then I'll go into the whole like, it's elective and the first option should not be a knee replacement. And then it's like the deep end. Then you're off. They're like, oh my God, I need a knee replacement. You're like, no. You actually asked me if you need surgery. And then I said the word knee replacement. We shouldn't go there. And then for some reason you heard me say you need it right now.
Yeah.
That's tough. Or they come in and they want surgery for something that is not surgical.
For us, it's ganglion cysts. And I don't know if it's like meniscus tears.
It's patellofemoral pain.
Patellofemoral pain.
Yeah.
Mm-hmm.
They think surgery is going to fix the fact that their kneecap cracks and pops.
Yeah.
Or that they hurt kind of in the front of the knee with certain things.
Yeah. Yeah. Ganglion cysts are that for me. They just don't get better with anything.
Yeah.
Yeah. I don't know. I've come to the point where I'm just very honest. I'm like, these just don't get better when we do surgery on them. Yeah. Sorry. So
yeah.
That's
tough. I don't like those ones either. Those ones are very difficult visits. Or if you have we had a girl who came in who had, she tore her ACL, and she had at the time of the tear, her foot subjectively went completely numb, couldn't feel it, foot drop. Right. And there are a subset of patients that will get hit from the side, like lateral side or non-contact, that have completely knocked out their peroneal nerve. And I've seen it. We had a patient that was 18, non-contact, foot drop, had to put him in a brace, and EMG showed that. This girl, she, had said all these things. So EMG completely normal. We did vascular studies because she was complaining of her foot being purple, completely normal. Right?
Mm-hmm.
After surgery, so operate on her knee. Again, for anyone who does this, big chance of this patient getting CRPS because she had these symptoms beforehand. So afterwards, she'd complain of her thigh turning purple. It would literally, during physical therapy, it would get a massive lump in it and turn purple. No one saw it, not even her therapist, but she would come back in.
But it happened during therapy.
It happened during therapy. So she'd come back in and complain about it. So I got her vascular studies again, and it was completely normal. Mm-hmm. And her mom comes with her, and her mom's like, "You're not hearing her." And I'm like, "Oh no, I'm hearing her.
Yeah.
I just don't have anything that shows me that that's real."
Yeah, we can't, what do you want us to do? Operate on something that we can't prove exists? Because my chances then of you getting better are...
So I went down the whole path of CRPS, and she was like, wait, so now I need to see someone else? They're not going to believe me either. And I was like, right, but if you're saying this is happening, this is the best course of action. They were mad at me first for not believing them. Not that I didn't believe them.
You did.
And second, for setting them up with a physician who would handle that type of thing, which we don't. And they're actually mad at me for sending them out.
I don't know what those people want. I don't know what the end goal is.
Yeah. But when they come in and they have a family member who's like, no, you have to believe them. I'm like, whoa, this is a 2 versus 1. I never said I didn't believe them. I'm just saying, I don't see anything purple.
What about other medical professionals that you see and treat?
Oh,
is that a little awkward and it depends on how they approach it.
It depends on how they approach it. So what I hate is when the nurses are like, I'm a nurse. And I'm like, yes, you are, because I wouldn't leave this room unless you told me that you are. They generally,
bound to happen.
Yeah, they generally will tell me what they should and shouldn't take for pain control. That's the nurses will do that. The physicians that we operate on, they're the worst patients. Worst.
Yeah.
They just are non-compliant. They do whatever they want.
Yeah. I mean, I feel like I would be that way too.
I'd 100% be that way too. But I don't know. I feel like the benefit of the doubt is I know you know better, right?
And but you're part of the system. We're part of the club.
Yeah.
We get each other, right?
Yeah.
I don't know. Sometimes there's a big mismatch sometimes.
Yes.
Though.
Yeah. Well, we had this one guy who he's retired now, but he has a practice multiple towns over, and he's a supervising physician for a physical therapy office that PS I hate for shoulders. And he came in for a shoulder. He had to have surgery, and we had the conversation where he was like, hey, I want to do rehab at this place. What are your thoughts? And I was like, oof, I knew, his affiliation before. And I was like, well, you've got a big tear, and big tears are not done well by a lot of people. I really have a team that I know will handle you well. Let's start you off there. And then once you get to the point of strengthening, then I'll kick you over there. And he was really hesitant at first, but now that he's a couple months in, he's like, I'm really glad you did that. And I was like, ooh, but what does that say about your support of that practice?
Yeah.
Now
he's questioning it.
Yeah.
Maybe.
That's awkward. Like most things we're talking
about
today.
I had an awkward encounter just yesterday. I worked a urgent care shift yesterday, and so I take daytime call or whatever you want to call it. And a post-op patient of another surgeon in our practice, they were having some issues, and the husband of the patient called, and I saw on like the message, it said Dr. So-and-so. And I was like, oh, but it was the same last name as the patient. So like, obviously I already know like their spouse is a physician. So I take the call. The first thing he says when he answers, he's like, I'm a retired general surgeon. I'm like, okay, yeah, I figured that much. And I don't know so I answered the call just with my first name, right? Like this guy doesn't know me. He's like, oh, I'm getting to know a lot of people in your practice. I know this person, never talked to you before. I don't know if he like Googled me on the spot immediately, but he then proceeds to say
to read you your resume or your interests.
He then proceeds to say, I know this may be a little out of your scope of practice since you work for a hand surgeon, but
ooh, and I was like, Google you.
Ooh, like I'm kind of offended by that statement.
Yeah, he Googled you.
What?
Yeah. Wait, did you satisfy whatever he needed?
No.
No,
because it's out of my scope of practice, Beth. I work for a hand surgeon. Okay,
you know nothing else. I forgot.
Yeah, no. The guy was requesting that I find the personal contact information of a general surgeon and on a holiday and give him their cell phone number. I was like, I'm just not going to do that.
Yeah, that's
sorry, like not appropriate. We are not going to play that game.
Wow.
But yeah, he's like, yeah, I know this may make you uncomfortable because you work in hand surgery. Like,
ew.
I love hand surgery. Okay. Patients don't have to take their pants off.
Hold that against. I know they don't. They never do. They will, but they don't have to.
They might. Yeah. Well, in our other offices, I'll see other complaints sometimes, and those are the days that. Yeah. That those things happen to me.
What about the patient that, let's say it's workers' comp, right? Let's talk about that for a second. What about the patient who, like,
the malingering? Are we getting there?
Yeah, I think the one that like fakes their physical exam.
So I have a story about this.
Okay.
And it goes way, way back.
All right.
And I think I don't know if you were here at that time. You probably were.
Okay.
It's in the other office.
Okay.
And this is like, when I think about malingering patients, this is a specific instance that comes to mind because the captain, I was working on his team at the time, and there was a patient that you guys had done a cuff repair on, and he had like very guarded range of motion, like everything was terrible. In exam room, he's like barely moving his arm.
Yeah.
And he goes out to the parking lot, and the way our other office was set up, like we're on the third floor, there's windows everywhere, and he would walk around and dictate, and you could see out the windows to some areas of the parking lot. So we saw him, the window, like walking to his car, swinging his arms aggressive, like, and like reaching and doing things, and then like dictated about how he visualized him out in the parking lot, like doing those things. And that's my favorite memory of lingering. Like just the passion in his voice dictating that. Yeah. After seeing it.
Yeah.
Yeah.
No, I've seen patients in the room like won't move their arm or like can't move their leg, and then they get up to walk out of the office, and I see them like with the arm, they get up to get their jacket on and can very easily get their arm into their sleeve. Like you can't do that at a certain stage when you're,
but like when I ask you to internally rotate, you're like,
but then put on their jacket, no problem. Or the one who like can't walk normally and they get up to walk to x-ray or get up to walk out of the room and they're walking completely fine. Some workers' comp carriers will videotape these patients. Like they don't know that, but they will do that not in the office, but like outside.
Yeah.
I've had that happen before where they're like, hey, so I saw this patient literally like put together a stone wall and you said they can't do anything but desk work. And I'm like, God damn it.
I think our athletic trainer, her husband's past job was to do that.
Yes. Oh my God.
To video like cases like that.
Yeah, like private investigator type stuff.
I feel that with when I ask people to like bend their fingers and make a fist, and I get this weird like I can't even reproduce it, like this contorted version of like
a claw hand.
Yeah, like, who's ever done that? Like, what are you doing?
Yeah, my fingers won't respond to what you're telling me to do.
But then I see them like reach in their purse, their phone starts ringing, and they like grab their phone
and
clasp around it, and I'm like, but you just bent it.
Yeah.
Then I ask them to bend it, and they're like, oh, I can't.
Will you call them out?
Sometimes.
Yeah. But I'll tell you, like I love seeing patients in all walks of life that they come from, but these like awkward interactions, they make for great stories.
Oh, I love it. Yeah. And you have the best ones.
Oh God.
What about when you have patients who like ask you about post-operative,
physical
like
activity,
what they can and can't do after surgery?
Yeah,
Yeah.
Oh yeah, they will ask oftentimes about sexual positions and when it's okay to engage in such things.
I really just wanted us to get here the whole time.
Okay,
I was waiting for this.
Yeah, so shoulder patients, yes. Knee patients, yes. The random hip patients I'll see, a lot of the hip patients I'll come in, I'm like, when does it bother you? They're like, well, it bothers me because I can't get into the positions I want. And I'm like, say less.
Yeah.
But yeah, the shoulder patients, I had a post-op patient. I had a post-op patient like very recently. She's progressing well and did a really big tear. She was talking about in her Jeep, like reaching up to her visor and how that was like a really big deal for her to get her sunglasses because that was like a definition of what she couldn't do before, right? So now she's getting back to her activity. I was like, all right, great. We're going to go to overhead strength. We're there. We're kind of at the last bit of rehab and then we can talk about going back to work. And she's like, I have one more question. I'm like, okay, go, fire, anything. Mm-hmm. Again, I invited it, right?
Yeah, ask me whatever you want. I am your therapist and your provider.
Yeah. So she said, do you think that it would be okay for me to resume use of my vibrator? And I was like, yes.
How aggressive are you using that vibrator?
I was just like, yeah, I think it should be okay. God damn it. Like, no facial reaction. I'm like, but I would just never ask a provider. I would never ask that.
No.
Because if the answer was yes or no, like, would my life be any different? I don't know. You know what I mean? Like, would I change my behavior based on their recommendation?
No, I see what you're saying, right? Like if you're gonna do it, you're gonna do it. Yeah. You're there.
But patients love asking stuff like that.
Yeah.
What about for you?
Yeah. I don't know that I've ever had anybody ask about like when they could do certain things. I'm gonna stop saying what I was gonna say.
Well, I had a guy. We fixed his shoulder, and a lot of the guys will ask, "When can I ride my motorcycle?" Like, leaning down.
Mm-hmm.
And I had this one guy, and he was like 70 something, right? And we had gotten to the point where he had a really big tear also, and he got to the point where he could raise his arm over his head, but he was really uncomfortable, like putting weight on his hand, like get himself up.
Mm-hmm.
So I was like, all right, well, you could always use the other hand. And he was like, but when can I make love to my wife? And I was like, oh my God, like whatever you want. Okay. And his wife's right there.
She's in the room.
She's in the room, but he yelled, like he had that under wraps for months.
He was waiting to ask you that.
Waiting to ask me that. I just don't think the physicians get asked these questions.
No,
I'm begging.
Is it like a male female thing? I don't know. Like,
I'm begging a physician to tell me right now.
Yeah.
Like, no, I get
if you're
that
a physician and people feel like empowered enough to tell you these things, we want to hear about it. Yeah, we do some hormone replacement therapy. Certain providers in our office do. Yeah. And every so often I'll get like casually on the conversation of that because I'll see patients who like we've sent to them for that. And I think this is a mutual patient of ours, actually.
Yes.
Yeah. I was seeing him and he was telling me about like his testosterone replacement therapy. And he's like, oh my gosh, it's going great. I'm feeling great. Like the only person who complains about it is my wife because I'm after her like a rabid dog. And I was like, oh man.
All right.
Good for you.
Good for you.
Good for both of you.
Yes.
Like, I'm really happy for you.
Yeah. So
and like she's out in the waiting room and it's just me and him in the room. And then he leaves and like I'm making eye contact with her and and then she's my patient too. And so I see her the next week.
Yep.
I will end with a couple of weeks ago. I was in one of our more rural office locations where just a different patient population exists. And we had an older gentleman in his late 80s. And, our athletic trainer, her and I don't look the same. Like, we look very different. We have different color hair even.
Yeah.
So I leave the room. She goes in to do something. And he's like, aren't you the same girl that just came in here?
She's like, pretty sure I'm not.
She's like, no, that was Hannah. And like, we look different. And also we're wearing different color scrubs that day.
Yeah.
I'm in like hot pink and she's in navy. And he's like, you guys look the same. She's like, okay, like I'm going to continue what I'm talking about. He's like, yeah, you guys are both short and stocky.
Oh my God.
Yep. And so and the door is still half open at this point. And she looks at me and I look at her. So like, I am very passive and I try to appease situations, just like make things go away. So I'm like, oh, God, like we don't look the same. Like, look at us. Our hair colors of our scrubs are different. He's like, no, you guys are both short, stocky, chunky monkeys.
Oh my God. Oh my God. Listen, that is so offensive. I would have died.
I did die, but I'm like, he's 80 something. Like,
but
I guess he gets to say whatever he wants, right?
Yeah, he does. No, I had a patient. This was like just last week, and I had a student with me, and the patient was like, oh yeah, so last time we had seen each other, we were talking about hormone stuff and intermittent fasting and keto and all the things to lose weight. So she was like, oh, are you still doing intermittent fasting? Last time I talked to you, you were. And I was like, yeah, definitely still doing that. She goes, oh, well, you and I were like two peas. Aren't you just right behind me age-wise? And I look at her chart, she's 57. And I was like,
yeah,
no.
Yeah.
Right. And so my student was like, we came out of the room, my student was like, for the record, I thought you were 32. And I was like, for the record, I'm not 57.
Yeah, like
I was so offended.
I had a lady
was like, oh, well, I'm sorry. Maybe I thought we were. And then I felt the need to tell her my exact age. And I was like, screw you.
Oh my God. I had a lady once she was in her early 50s and we were talking about working out and she was like, yeah, women our age really need to focus on strength training. And I was like, women our age?
Yeah, do not group me with you.
Okay.
Anyway, so I think moral of the story is patients are an open book and for some reason we attract it.
Yeah.
And it's not going to end anytime soon. And I didn't even talk about the most offensive patient encounters that I've had.
Are you saving this for another time?
I think so.
That will be a separate episode called The Most Offensive Patient.
Well, actually, for our end of the year, top 10, right?
Our top 10 patient encounters?
Top 10 or like top 10 like best moments or worst moments.
How
I don't
about
know.
like the three best and the three worst?
Yeah, outrageous.
Yeah.
Because I have a couple outrageous ones that I'm not ready to talk about.
Gosh, yeah. I need to start collecting those. Okay. Well, until next time when we discuss the most outrageous things.
Bye. Thanks for tuning in to Joint Effort PAs. If you enjoyed this episode, be sure to subscribe, leave a review, and share it with a fellow PA or med-minded friend. You can also follow us on Instagram at Joint Effort PAs for updates and extra content. See you next time.